Good morning. It's Wellness Wednesday, and I'm going to kind of touch on a hot topic today. What's a normal, and I'm going to put in quotes, what's a normal thyroid? I get this all the time, you guys. It's just unbelievable. I really believe the thyroid has been mismanaged. And I say that like almost cringing in my stomach, going, oh, I'm going to hear a couple things about this from people. A normal thyroid might not be the same for you as it is for me in the general text of things. So let's get specific. So there are numbers that our labs have created with that, what you've heard me talk about, a bell curve, where a majority of people are in that average range. And if you fit in that, then your thyroid has to be normal, right? Well, I'm going to tell you wrong, because I might have symptoms outside of those ranges and then unfortunately not be correctly diagnosed. And then now I've got these symptoms and I've been told that it's in the normal range, so get over it. And that's what really upsets me, because I think what I have chosen to do with personalized medicine is look at your list of symptoms, look at those numbers, and then put together your plan for you. And that's what I'm going to encourage you to do when your gut's telling you, I think my thyroid is off. Now, do we blame the thyroid for a lot of things? I'm going to say, yeah, sometimes it's not our thyroid. But I'm going to encourage you to check more than one level, okay? The most common thing that's checked is a TSH, thyroid stimulating hormone. Guess what? The TSH doesn't even come from your thyroid. The TSH comes from your pituitary gland. And so it's only one piece of the puzzle. It's not even telling us how much active hormone is going on in our bodies. And so when we check the thyroid, we need to do more than a TSH. And unfortunately, medicine is behind on that. And you might have to ask your doctor or your health practitioner for more than just a TSH. Hopefully they're testing more than that, but if they're not, you're gonna have to kind of say, I'd like to see what these numbers are. And so for sure, you wanna get a free T3. That's the most active form of thyroid. You wanna get a free T4. Those of you who might have an autoimmune condition called Hashimoto's, you might want to get your thyroid antibodies to see what's going on, what's the level of inflammation. So as you can see, there's probably 7 or 8 thyroid labs that are out there to give us the bigger picture of what's going on inside of you. So what does an abnormal thyroid maybe feel like? It can be brittle hair that's breaking, or you're having tons of hair loss. So you can have hair loss of maybe 10, 20 strands a day, but these are like my patients will show me a glob of hair, or their husbands will be like, what are you doing? I'm having to unclog the shower. Like, there's so much hair in there. Another one is hands and feet cold, being cold. Your body most of the time is warm, but your hands and feet, you want to sit on them your hands in between doing things because they're so cold. Or your feet, you'd rather have socks on when it's supposed to be like in Arizona 90 degrees and your feet are freezing. So that's a really good symptom of low thyroid, is cold in feet and hands. How about trouble losing weight? Again, remember I said it's not the only thing. Like, trouble losing weight can be so much, like your diet, your sleep, your exercise. There's so many other things, but thyroid trouble with and everything is aligning and you're having trouble losing weight might definitely be your thyroid. It connects to your metabolism. So the thyroid is so important. It's not just for weight loss, you guys. Our thyroid is very much intertwined with our other hormones. For those of us who are women, our menstrual cycles. Thyroid has to do with how our nerves even respond. You can have numbness and tingling. You have palpitations when your thyroid's off. You can have fuzzy brain. So it's important to know your numbers. And it's also very important to have someone look at all of those, look at your symptom list, and then decide what the best treatment plan is for you. You know what else is important? Excuse me. Maybe you have low iodine or selenium or some of these other nutrients that are needed for your thyroid to work. Where's your thyroid? It's right here, kind of right on top of your Adam's apple. And so that's what we're trying to figure out. And we might feel around and see if there's a nodule there. It might get really sore or tender. I've had a few people who have had the horrible COVID infection and now their thyroid's not working. So can it recover? It sure can. With the right things, we can actually help a thyroid recover if you have something called thyroiditis, which is inflammation of the thyroid gland that can happen from a viral illness or extreme stress or a pregnancy. So I want you, hopefully you're feeling encouraged right now and you can pass this on to somebody who's been told that their thyroid is fine and they're thinking their thyroid isn't. Go get more lab work done. Sit and have an actual conversation with your practitioner and let's get to the bottom of this. And guess what? You've heard me say this too. Your diet does make a difference. If you've got an autoimmune condition called Hashimoto's, guess what gluten likes to do? It likes to compete for the same part, that same receptor in your body for the thyroid molecule. And you know who wins? Gluten. So we can actually change and encourage a diet that supports your thyroid. And so I just wanted to send a little bit out there. Hopefully you're encouraged. Some of you are feeling, oh my gosh, there's someone who might listen. The answer is yes. And so go get your thyroid checked out. It's an important hormone in our body, and it's more than just weight loss. It's tied to so much more. And so know your numbers, know the symptoms, and find someone who can personalize your treatment program for you, because there are multiple forms of thyroid replacement, and we could even have a longer conversation about that. Okay, have a great Wellness Wednesday. See you next week. Bye.